Hello, welcome to our podcast. This is our first episode. We're both very happy today. Me, Paula, and Marty, my very good friend. We live here in Oregon, in the US, and we thought that the first episode could be about us and why we're doing this, right? So I'm going
Absolutely.
to start with Marty, my dear friend. Marty, tell our listeners a little bit about yourself.
Well, as Paula said, my name's Marty, and I have been the privilege to be a university professor for a number of years. And I really identify as a peacemaker. I want the world to be at peace, and I want there to be the kinds of things that happen in the world that make peace possible. For that reason, I have spent the journey of my life studying at universities and teaching about issues in peacemaking. I've done that largely from a religious context, though I keep open to lots of religious difference. I've traveled the world and had opportunity to explore lots of cultural experiences. And I just want things to happen in a way that our world and our people can be more at peace. I work as a therapist also so that individuals, families, and communities can be more at peace with themselves, with each other, and the world. That's a little bit about me. Paula, how about you? Why don't you tell us about your experiences and who you are?
Okay, let's do this fast, right? We agreed in a minute and a half. So I'm from Brazil originally. I worked most of my life in as not as a therapist, but as a journalist. For 20 something years, I worked as a journalist. And then, when it gets to a point in your life, you say, I've done everything I wanted to do. I wrote books, I worked for TV, print, radio. And actually, this is one of the reasons why I love podcasts, is because I loved radio. But then I was really tired of being a journalist. It's not a good time to be a journalist, as I'm sure most of you might know. So I decided to do something else. I had a very difficult time in my family after my father died, and he died by suicide. And that was the reason why I decided to work with suicide prevention and become a therapist. And then one day I met Marty, and we were let's just tell them how we came up with the idea,
Sure, but
right?
before we do that, you need to tell our listeners about your other podcast and your award-winning book. They need to know about your leadership and what you have to offer in that
Oh,
venue as well.
okay, all right. Well, anyway, I was going fast through that, but okay. So I have another podcast. If you are interested, a lot of people, unfortunately, are dealing with mental health issues, and many of them get into suicidal thoughts, suicidal ideation. Many families are going through this right now. And unfortunately, a lot of families also lose people to suicide, which is what happened to my family. So, my podcast, I've had it for 2 years. I interview a lot of specialists. It's called Understand Suicide. You can find it everywhere. I interview families. I talk a lot about grief. So I give a lot of resources on grief. That's one of the areas that I'm very passionate about. So that's what the podcast is about. It's about the audiences, people who are struggling with suicidal thoughts or families who are struggling with loss. So
And
that's
of
the
course,
podcast. Yeah. Mhm.
And of course, that's Paula's other podcast, award-winning book, etc. But on this podcast, obviously, we're doing something different. So
Very
you
different.
asked me, Paula, to share a little bit about my sort of interaction with psychedelics and
Yeah, yeah.
yeah. So first of all, I'm probably going to be unique in the fact that I have a podcast and we are developing a podcast, Therapy with Psychedelics, and I've never used psychedelics.
Neither have I.
In in fact, I'm not much of a drug user at all. I've never used drugs. So the weird thing is, why is a guy like me doing therapy with psychedelics? Well, let me tell you why. I moved to the state of Oregon during the pandemic in the year 2020, and I moved leaving my university job to become a therapist. I really wanted to be in Oregon. I was born and raised here, but at the time there was a measure going through to allow for, if the voters in Oregon passed it, and they did, the legal use of therapeutic interventions with psychedelics. And the fact of the matter is, I've been reading the science, watching videos, following what's happening with psychedelics, and psychedelics had already been back in the 50s and 60s, before they were classified as a illegal drug. They were already demonstrating.
Class A, right?
Exactly. Is it class A or class one? We'll have to learn all
Class
of these
one.
things.
Yeah, that's why we're here. We're going to learn
We'll learn together
yeah.
and we'll get all the terms correct. But once that happened, what was already developing with the use of psychedelics that was helping people with issues of depression and issues of end of life, and it wouldn't have been incorporated with PTSD then because that nomenclature didn't exist, but it was helping people deal with their trauma. And anyway, that got shut down because of government rules and regulations. And it's only been recently that people are talking about what's called the third wave or the Renaissance of psychedelics again. And the facts of the matter are in the science, in the studies that are being done in clinical facilities and medical facilities and university facilities, psychedelics are demonstrating they can give people greater peace. They can help people come to terms with depression and trauma and end of life issues. And since I want people to live at peace, and I want people to have the kind of comfort, I have been tracking the science, and here we are, Paula, talking about it and learning more about it.
One day we were talking, and he came over for dinner, and we were talking. I said, "No, Marty, have you're reading about the Psychedelics Revolution?" And I had actually finished a book about it, and I had read another book that ended. The end of this book said, but I know because of the 70s and everything that happened and all the politics, but the revolution of mental health treatment is in psychedelics. And I remember that, I never forgot that. And so I was talking to Marty. We were here just having a glass of wine and having some fun. And I said, I'm really interested. I would like to be certified because the research is solid, because even though it was banned in a way in terms of medicinal
legal
use, the research continued to be done, right?
Yeah.
Most of it was shut down because they didn't have funds, but a lot of it continued to be done, and thankfully it did. So we know that it's very helpful for depression that is treatment resistant, for PTSD, end of life issues, as you mentioned. And then we were talking, I said, listen, and we started looking for research and all kinds of resources. And we just had the idea, let's do a podcast on it, because there's so many questions that we have, so many questions our colleagues have. So why not provide the information? So
well, even in the clinical world, I know that I shared that I was interested in this with some people that I work with that are colleagues, and they basically were down on it. And I basically said to them, man, you've got to read the literature. You got to read the science on this.
There's a lot of, there's so much resistance. Yeah.
And because of the way psychedelics have been used popularly and at raves and in popular settings at concerts. Exactly. And really what we're doing is we're tracing the science on it, and we're saying, if there is a therapeutic intervention that can be administered in a safe context, in a principled, ethical, integrous way with people that gives them wholeness and helps them feel better, we want people to have that. Paula, you and I obviously do therapy. We spend weeks doing talk therapy with people, and there's lots of different kinds of interventions that therapists use in terms of CBT and ACT theory and existential
all the letters, all the letters that we use.
And those things matter and they help. But the science in the early studies are demonstrating that the use of psilocybin or other psychedelics, along with an integrated psychotherapeutic healing whole relationship, can give people greater wholeness for longer periods of time faster. And that's what we want for people.
Yeah, we want, this is something that we have in common. And I think that's what brought us together, Marty. We have values in common, right?
Absolutely.
And as therapists, we both want our patients to feel good about their lives, to lead meaningful lives, not just deal and learn some skills so they can deal with their daily struggles and the next week they need it again. We want them to, as you said, to find wholeness, to find meaning, to have a life that they really want for themselves. So if psychedelics help, that's what we're here to do.
And of course, that is about flourishing, a life of flourishing, which is what we want. So we have, the one thing we'll follow probably most specifically with this podcast would be psilocybin, because that is what's going to be legal in the state of Oregon.
Mhm.
But this podcast will not be limited to that because we want to follow all of the other, as Paula has said, ketamine and
Ketamine
DMTs
is
and
already being done too. So
absolutely.
we want to give you, our listener, knowledge. We want you to feel, if you are someone who thinks about maybe I should try this as a patient, as a client, but where do I get information? Come here. That's what we're going to do. As we said in our intro, we're going to investigate, evaluate, explore, and we're going to
Absolutely.
learn with those who are doing it, either from the point of view of a client or a patient, or
Yes.
research. We're going to bring like the top leading researchers here to talk about this. You're going to know everything you need to make an informed decision.
And it should go without saying that while I'm a traditional European descendant American, Paula is from Brazil, we want to have indigenous persons. We want to have Black, indigenous people of color. We want to be aware that there are theys and thems that will join us on this journey. And
Yes.
there are lots of diversity that comes into this. It's also the case, of course, that psychedelics, because it has been used illegally and at raves and concerts, there's sort of a fringe movement to this. And our goal is we'll incorporate people who maybe have been using in different ways because they've had experiences. But again, we want to focus on where the science is, where the medical studies are being done,
Mhm.
and how practitioners can use this. And then, of course, while our idea is that this is going to help therapists, we certainly also hope it might help people who might eventually think about taking or participating in the integrative practice and integration cycle of connecting with a licensed psilocybin therapist in the state of Oregon when that finally
Mhm.
legally becomes possible, January 2nd of 2023.
Yeah, we're almost there. I mean, in a blink of an eye, it will be happening. And there are many colleagues of ours who are interested, but they need information, they need knowledge. And that's what we're going to bring here with this podcast. But just so this is clear, we're not just going to talk with Americans. We're going to talk, I'm actually just now trying to getting in touch with a few places in London. Wherever this is being done responsibly and science-based, we're going to be interviewing them. So
We'll
and
review and engage with authors, researchers, experts, users, clients, and other therapists.
yes, and for fun, we're both actually, I was thinking about this, Marty. I don't think I mentioned to you. We are going to review. There's two. I just watched two great movies about psychedelics. They're kind of documentary, but one is very funny. So we're going to review that too. We're going to talk about books. We're going to review books, whatever comes in terms of content. And of course, we're going to have a web page and with resources. So that's coming more into the future. But for now, we're going to start with interviews here. So
You know,
this is the place for you to know everything you need about
the language of
psychedelics.
using drugs is often going on a trip or
Yeah.
having a trip or going on a journey, the journey. And that's kind of the way we see ourselves. I
Yeah.
don't know that we're going to trip out here on this podcast, but we do want to journey along and learn the insights. And that's what we're here to do.
Okay, so I think enough. I think this is enough. But just so I just remember something you mentioned, Marty. You said, I maybe this is unusual. We're going to talk about this. I never tried one. Neither have I. I haven't tried drugs at all either. And I actually, just on a personal note, I've always been very resistant and
Mhm.
afraid of drugs because I have a very bad history with drugs in my family.
Interesting.
Yeah, so it's something that was very painful to me. So I resisted, and but I don't know. We might, right?
We'll figure it out. We're going
We're
to follow the
getting into.
science.
We'll follow the
And
science, and maybe science will follow us.
that's awesome.
Okay, Mari, I think this is enough. They know a little bit about us, what the podcast is about. We're very happy. This is our first recording, but we already have some guests lined up. It's going to be fun. We're going to learn with you, listener. Participate. On our notes, we have our telephone number, our email. So send us comments, ideas, questions. These are very important. You can record your questions, send it to the number that we have on the notes.
Let's head out for a great trip.
Okay, thank you. Have a good day. It's a Friday here. Have a good weekend, Marty.
Peace to you.